Welcome to Christie's Speech Therapy. I am Christy Sang and I am a speech and language therapist. Today I will present on the role of a speech therapist in working with stroke patients. What is a stroke? A stroke is a medical term that describes an event inside the brain in which there is a sudden loss of function, also known as a brain attack or cerebrovascular attack, CVA. It can affect anyone at any age. I know that some babies can have it when they're still in the wombs of their mothers. I've had cases where the child was 7 years old and had a stroke. I have worked with young people, young adults in their early and late 20s. And I've also worked with people who are well over their 50s and 60s. So it can happen to anybody at any age. And without a particular cause, they might be very healthy and still have it. First things first, let's learn about the symptoms. So internationally, we have an acronym called FAST symptoms, F-A-S-T. So F is for face. The face may have dropped on one side, the person may not be able to smile, or their mouth or eye may have drooped. A is for arms. The person may not be able to lift both arms and keep them there because of weakness or numbness in one arm. S is for speech. Their speech may be slurred or garbled, or the person may not be able to talk at all, despite appearing to be awake. They may also have problems understanding what you're saying to them. T stands for time. It's time to call for an ambulance immediately. If you notice any of these signs or symptoms, go straight to the A&E, go straight to the emergency department of the hospital. You must act fast. Some of the other symptoms that somebody who is having a stroke might display are sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes, so you might be seeing blurred things. Sudden trouble walking, dizziness, loss of balance or coordination. And finally, sudden severe headache with no known cause. It's a bit like a migraine, but it's not going away. According to the World Health Organization, 15 million people suffer stroke worldwide each year. Of these, 5 million die and another 5 million are permanently disabled. So this is why the World Stroke Organization is using the health system and stroke recognition core evidence-based recommendations to put a roadmap for quality stroke care. Let's see what it says in terms of speech therapy. Pre-hospital and emergency care. Number 1, following the roadmap. All patients with stroke should have their swallowing function screened or assessed by a trained healthcare professional, example a nurse, within 4 hours of arrival at hospital to determine possible dysphagia, which is a swallowing difficulty, before offering food, drink, or oral medications to the patient. Number 2, if there are any abnormal results from the initial swallowing screens, this patient should be referred to the speech and language therapist for a more detailed assessment and management of the swallowing. This should be done, the specialist assessment of swallowing should preferably be done within 24 hours of admission to the hospital and not more than 72 hours afterwards. It is important to act as quickly as possible to prevent complications and reduce mortality. Acute inpatient stroke care. According to a research done by Martino et al. In 2005, up to 78% of stroke patients have dysphagia, and approximately 50% of the dysphagia cases will resolve within 7 days. So back to our roadmap for number 1 and 2. That's why it's really important to assess the swallowing, nutritional and hydration status of the stroke patients to help them regain their swallowing abilities and to make sure that they are able to eat and drink safely. This will help reduce any health complications, and this will prevent them from developing aspiration pneumonia. Number 3, family members should be trained on proper feeding techniques for stroke patients with swallowing difficulties by a speech and language therapist. So during the formal swallowing assessment, the speech therapist assesses the muscle and nerve function responsible for swallowing. So they will be able to diagnose if there are any muscle and nerve impairment and prescribe an adequate feeding technique to enable the patient to eat and drink safely. Number 4, patients should be assessed for communication deficits by a speech and language therapist. So what happens when somebody has a stroke? Sometimes they are not able to talk at all. They only communicate through gestures. Other times they have word finding difficulties, so they are not able to communicate with you because they don't have the vocabulary to do so. And sometimes they are able to speak in sentences, but it's just gibberish, so it doesn't make sense. They are able to put words together to form sentences, but the words don't go together and are not appropriate within the context. So this leads us to number 5 and 6. So patients should have access to individualized therapy to improve their communication abilities, and their families should be trained to use some of the communication techniques. For example, if a person is nonverbal, so we would teach the families how to use a communication board, for example, or they could be using sign language. Areas of impairment following stroke. So when you have a stroke, there are different areas that can be impaired. For instance, you can have language and communication impairment, cognitive impairment, or physical impairment. Let's explore this a little bit more in details. Language and communication. Sometimes when you have difficulty coordinating the muscles of speech production to articulate words, this is called apraxia of speech. When you are experiencing speech muscle weakness and slurred speech, this is called dysarthria. When somebody has challenges with producing and understanding speech and language, this is called aphasia. Sometimes following a stroke, you can have the impaired ability to follow and maintain conversations, and you can experience some other cognitive communication disorders as well. You can also have trouble with reading, writing, or using numbers. Some cognitive difficulties that you may experience following a stroke are disorientation, memory difficulty, challenges with problem-solving tasks, emotional instability, and problems with attention, including visual neglect. Some physical impairments that may be the result of a stroke are paralysis or weakness on one side of the body, called hemiplegia or hemiparesis. You may have vision difficulties. You may feel more fatigue easily, and you can have swallowing and eating difficulties called dysphagia, as we've discussed earlier. Rehabilitation. About half of recovery from stroke occurs within the first month, but in many cases it can continue up to and beyond 6 months post-stroke. Adults having stroke rehabilitation in the hospital should be offered at least 45 minutes of each relevant therapy, for example, speech therapy, occupational therapy, or physiotherapy, for a minimum of 5 days a week. Talk to your doctor. Remember that the higher intensity stroke rehabilitation therapies can improve the quality of life for adults who have had a stroke significantly. So before being discharged from the hospital, discuss your rehabilitation plan with your doctor. Try to continue rehabilitation therapy with the same intensity and expertise as you've received in the hospital, outside of the hospital, when you leave the hospital and go back home. Talk to your doctor about your concerns regarding different areas of the impairment following your stroke, as we've discussed, language and communication, cognition and physical. Your doctor will refer you to the appropriate services, including, but not limited to, speech therapy, occupational therapy, physiotherapy, support groups, and counseling. Remember that rehabilitation takes time, and there are really good evidence showing that continuing therapy outside of the hospital will improve your quality of life. Even after 6 months, after a year, there will still be improvement. So good luck. I hope that this has been helpful. And if you have any question, don't hesitate to ask your doctor or your speech therapist.